Doctors, what's it like when you get sick? Do you go to the doctor or diagnose yourself? My father is a radiologist. He had been having shortness of breath and chest tightness worsening over a few months. One day, after work was done and the clinic was closed, he hopped in the CORT scanner and read his own CORT scan. Massively enlarged lymph nodes all through his body, lymphoma. He's alive and well, after diagnosing himself with cancer years ago. I was really a severe hypochondriac. If I had a headache, I just knew it was a brain tumor. When the AIDS epidemic started in the mid-80s, I just knew I had AIDS, but always wanted to be a nurse. Everyone in my family said due to my fears that there was no way, especially being around sick people. Nursing school basically healed me of my hypochondria. I was so sick of diseases etc. I've been a nurse for over 20 years, and one of those worst patients that doesn't go to the doctor like I should, or get proper preventive screening. I worked in the ED, and had blood splash all over my uniform, and did not freak out. As before, someone would sneeze on me, and I would panic. I come from a family of doctors. I'm a doctor, and I grew up knowing basically every doctor in my area. The best story I got is about a doctor we will call Graybow, perhaps one of the most senior and respected internal medicine doctors in my area. My dad is a workaholic. He loves medicine more than anything, and if he could do anything, it would likely be spending more time in the hospital. Me, not so much. Dad and Dr Graybow were very similar in how much they love their work. Dad and Graybow over the years became good friends, and had a sort of direct and cynical humor they shared with each other. At one point, my dad cracked a joke at Graybow, because he again showed up to work, even though he was a bit sick. Dad asked, "Hey Gray, when do you think you are going to retire? You are getting pretty old, and we don't want to have to pick you up off the floor here at some point." Graybow replied, "I'll never retire." Wait. Yeah, I will, when I die. Graybow never retired. A few years later, he was driving back home from an outing with his middle-aged son and he started having a heart attack. While I assume he was experiencing the severe and horrible pain of a heart attack, he just looked over at his son and said, "I'm sorry, I'm having a heart attack." He passed away after pulling over. The man apologized to his son for having a heart attack that he was completely aware of. I can't say I would have handled that like he did. My friend's parents are GPs, and there are laws in the UK, so you can't be formally diagnosed etc by family members. So as a kid their parent would take them to the doctors, like they have this and this, and the other doctor would just nod and prescribe medicine haha. There was a point I was awaiting to go in for an op, and it kept getting delayed, and then all of a sudden they called me up and said the NHS would be paying for me to go to a Bupa hospital and have the op. Spoke to a friend that worked in the hospital I should have been having the op in originally, and asked him if he could find anything out. Turns out the surgeon that was meant to be doing my op on the NHS had decided to do a favor for his girl friend by doing an op on her daughter, and made a mistake, but I was waiting on an op on Maya, so guessing it was the same for her. Not sure the outcome of the mistake, but he got suspended while it was investigated, and a few of his patients that were waiting for ops got moved to private at the NHS expense. 10/10 would want my NHS surgeon to do that again if it meant that I got to go private without the cost. My mom is a surgeon and my dad is an internal medicine. Both are very accomplished in their respective fields. When we were kids my sister got appendicitis and had to be operated. I remember seeing them worried sick and being a total mess. My dad actually cried when post-op my sister pooped for the first time. Not a doctor, but a long-term caregiver who's worked in hospice/mental illness/and developmental disabilities. I married a man with PTSD induced by severe childhood trauma. He suffers from severe depression and anxiety. About 2 years ago he had a mental breakdown after a large change in our lives. Actually several large changes. We got married, both changed our jobs, I had a major surgery, we moved, and adopted a dog all in the span of 6 months. The day his breakdown took hold, life had completely changed for him, and I had been hounding him to help me pack up our life every day for weeks and just didn't understand why he wasn't excited to be moving to a great new place that allowed dogs. He loves dogs. and as blatantly obvious as it seems now. I didn't see it then, and I deep down feel incredible guilt for being someone who has had so much training in healthcare and caring for others, watching for signs of mental health struggles. The fact that I not only didn't see him struggling, but also contributed to it, had made me question whether or not I'm a good person. I have felt so guilty for so long, but through therapy, have learned to understand that when it's your loved one, you are blinded by that. Your love for them hinders your ability to think straight, to see effectively the signs. And that's okay. Luckily I was able to get him help through therapy and some PRN medication. I feel so incredibly lucky to still have him today. And so incredibly guilty that I didn't help him sooner. Lowly med student. To be fair, that happens a lot, even when you are a patient going to a doctor, or several doctors. I went to about 8 or 9 different doctors, maybe more, several times each over a period of roughly 10 years for an exquisite jaw pain I would get sometimes. I went to neurologists, ends, oral surgeons, facial surgeons, you name it. Hell, even went to a sleep specialist because they kept telling me it was because I grind my teeth in my sleep. I absolutely do not. Every single one of them was 100% confident that I had TMJ. It kept getting worse over the years on what seemed like a logarithmic scale. It was so bad, I was taken to the emergency room one night after maximuming out my meds where it was finally figured out, which is ironic, because the pain was so bad I could only communicate by desperately scribbling on paper. I couldn't even verbally communicate, but they figured it out. I have trigeminal neuralgia rachitic Dowler-Ruxaka, the suicide disease. It's been posted about on Reddit a few times. It's the most painful fucking thing and I wouldn't wish this shit on my worst enemy. You live a half-life. You never know when the next attack is going to come. It could be at your wedding, your vacation, while you're giving a presentation, while you're taking a test, or somebody can just accidentally touch your head while reaching for support on a subway and send you into crippling, abject agony. Point is, every time a doctor would say take this and come back to see me in 6 months, they were dooming me to 6 more months of a fucking wretched, cursed existence. I even suggested this diagnosis a couple of times and was laughed at. Edit. Man, I was just bitching about my health, thank you all for the kind words. I've since had gamma knife radio surgery to try to ablate the nerve. For those interested, it was moderately successful, but I still take a regimen of drugs, an anticonvulsant. Seizures are when your brain won't stop firing, so anticonvulsants globally decrease the firing of these neurons, including the trigeminal nerve. This has some side effects unfortunately, an NSAID, and a muscle relaxer. Usually carbamazepine, diclofenac, and baclofen respectively has been my best combo, but will change it up when the pain gets too bad. I have injectable ketorolac that I give myself in my ass cheek on sudden onset and/or Valium. Valium is the best muscle relaxer. Sometimes the best thing it does is make me drowsy, though, as being unconscious is sometimes the only form of relief. I'm an anesthesiologist intensivist. I broke my ankle during residency. When I first saw my x-rays and realized it was broken, I cried not because of pain, but because of the fear of having to extend my residency. I crutched straight to the PD's office, tearful, to ask what I should do next, and he was just like, man, tomorrow's OR schedule is really tight. So I ended up just working in the OR the next day, first on crutches as then using one of those knee cruiser scooters. Unfortunately the joint space was widened on the follow-up imaging, so I needed an ORIF. I took 4 days off after surgery thinking I'd be fine, but I didn't anticipate the amount of edema I'd have and how much I'd need to elevate my foot. So midway through the 4th day off, a Thursday, I realized there was no way I'd be able to go to my rotation the next day without extreme discomfort, and that, if I did go, I'd basically be useless. I figured Friday and the weekend would be enough time. So I emailed my attending on that rotation explaining the situation, saying I didn't think I was recovered enough to come in. He emailed the whole team and my PD, but he put recovered enough in quotation marks, which I thought was super snarky and rude. But whatever, we have sick leave for a reason. The complete lack of support from so many people in my program, not all, our chair helped find me alone in a cruiser scooter until I could get my own, was really disheartening. I try to be an understanding attending, and I definitely never give a resident shit for attending to their personal health. I see a lot of variation. Some are ridiculous and have to be physically dragged to see another physician, where they sulk like a child because they are being asked all the normal questions that need to be asked when someone is ill. Some are very stoic. They know what needs to be done, they just sigh and get on with it. I think I've seen this more in physicians who get a significant diagnosis too. They know what the prognosis is and the treatment. I've only seen a small number freak out, generally refusing to get something checked because they are convinced it's something malignant. I don't think I've ever come across any hypochondriac clinicians. But have you ever come across a med student that wasn't at least a bit of a hypochondriac? I may buck the trend a bit, but I tend to consider any major ailment/symptom seriously, and I usually won't hesitate to consult a colleague to get their thoughts and set up an appointment with my own primary care doctor if it's something I think needs a medical workup with blood tests and radiographic imaging. That being said, my symptoms have to be damn well serious before I even think about going to the emergency room. After you've worked there and realize some of the straight up non-emergent nonsense people complain of, it's hard to justify checking in unless I have something I think could kill me or maim me. A nurse recounted to me how one guy went into R&D at 3 AM Sunday morning because he had an abscess on his back and he couldn't sleep. It was a pimple, not even an infected one, and his wife had refused to pop it for him. Also keep in mind 3 AM is when the pubs here close, so there's quite often a small rush of alcohol related issues and the like, as well as drug users seeking needle kits. I've been that patient before. I was home alone, having heart palpitations and shortness of breath before bed, and when I woke up it was worse. I got in my car to drive to school, and my heart was racing so fast, and I felt like I was going to pass out, and my heart was going to give out, so I called my boyfriend, hung up on him, and called 911. By the time I was in the ambulance my heart rate went down to 120, and by the time I was at the hospital it was 90, and slowly went down to like 80 or whatever's normal I guess. I sat in that damn hospital, pretty much completely fine, for 2 hours, before they let me leave. I was so pissed that I was taking up a spot in a busy hospital with people waiting, and everyone treated me like I was crazy, even though I seriously thought I was going to pass out at the wheel. And now I don't know what even happened. I have a myriad of weird mildly annoying issues that could have caused it. Fucking sucked man. Edit to add my labs were completely normal. Thyroid was fine. Have autoimmune hypo, and whatever cardiac enzyme they tested for was normal. I honestly might just have a weird blood pressure thing when I stand up that makes my heart rate sometimes soar. My health plan has a nurse advice line, which I sometimes call, but they've told me to go to the emergency room over stuff I didn't think was an emergency at all, and turned out not to be. I think the advice nurses were just doing sire, but should I ignore when a nurse says go to the emergency room? I just go and say I don't really think this is an emergency, but a nurse told me to come here.